Welcome to our online tutorial on preparing vehicles for the transport of people, materials, and/or equipment within the health sector. This is aimed at the Level 2 Healthcare Support Services course, and you will need a pen and some paper to make some notes as we're going along. So our aims are to understand the current legislation, national guidelines, policies, protocols, and good practice relating to the transport of people, materials, and equipment. We also want to be able to prepare the vehicle prior to use, be able to record and report faults and problems with the vehicle, and be able to safely load materials and equipment prior to transport. Most of your written questions are going to be in the first aim, and the last three aims are only about 3 questions, so it's fairly short. Alright, so first things first, 1.1 is to summarize the current legislation, national guidelines, policies, protocols, and good practice guidelines for preparing vehicles for the transport of A, people, and B, materials and equipment. Can you think of any of the above that apply to the transport of people or materials and equipment? And just pause the video for 2 minutes and write down what you think. So you can pause it now. So I have a few ready for you. The first one I want to talk about is moving dangerous goods, a guide to the international regulations on the transportation of dangerous goods by air, sea, road, rail, or inland waterway. Now it does say international regulations. These are agreed internationally, and they apply in local context as well. So this is a set of guidelines, and it has to be, and it's compliant with it says we have to be compliant with the carriage of dangerous goods and the use of transportable pressure equipment regulations 2009. It says that it tells us what dangerous goods can include. So some examples include explosives, flammable or toxic gases, oxidizers, or toxic or infectious substances. Now, a lot of people think of oxygen as being a flammable gas, but it's actually an oxidizer. It doesn't technically burn by itself, but it can cause a flame to flare up and be bigger and more dangerous than it would otherwise be, and therefore it is a dangerous substance. Infectious substances would include bodily fluids, which may come up in your row. So what these guidelines say is that a business that regularly carries any sort of dangerous substance under the legislation has to appoint a dangerous goods safety advisor. Now it also says if you're only carrying small amounts of the substance or you're not carrying it regularly, you don't need a dangerous goods safety advisor. If you weren't carrying goods often or you're only carrying a small amount, a DGSA might be a bit much for what you're doing, because they are, it's a full role, they have to do an annual report, they advise on the plan for carrying dangerous substances, so it might be too much in some places if people are only carrying dangerous goods temporarily or not a lot. Our next few that we want to look at are legislation. So one that I do want you to think about is the Disability Discrimination Act 1995. This one has since been overtaken by the Equality Act 2010, but it was the one that introduced a duty for service providers, which we would be included in, to make reasonable adjustments to allow disabled people to take advantage of their services. Now, that means putting ramps on the vehicles, It means having spaces for wheelchair access. We can reasonably assume that some people will need stretcher access or will be bariatric cases. That's the one that says that we have to make adjustments to make sure our services are available. Now, the Equality Act has since taken over. It has said that we can't discriminate on the basis of age, disability, race, etc. And it does cover, same as the last piece of legislation we talked about, it covers disability. We can reasonably assume that we will have a lot of people with disabilities who do need to use the service. So under this Act, we need to make sure that the vehicle is prepared and safe and available to people with disabilities. A lot of people wouldn't consider it, but you'd also have to consider disability covers mental health problems and conditions like autism spectrum conditions as well. We would have to consider those under this Act. So if we knew that we were potentially going to have somebody who has mental health problems or autistic spectrum condition or anything else that would also be covered, we'd have to make sure that the vehicles are suitable for them as well. So if there was anything in particular that could be dangerous, that would have to be sorted out. And that would be part of the preparation of the vehicle. Another piece of legislation to consider is the Health and Safety at Work Act. You are working on the vehicles and it is where the service is provided to the service users. Therefore, the Health and Safety at Work Act applies. It says that it says that we have to provide a safe working environment. So the vehicle has to be safe. That's why we have to check it and make sure it's safe and keep maintenance up to date ahead of going out to see patients. We also have the Lifting Operations and Lifting Equipment Regulations 1998. This one deals with specific hazards or risks associated with lifting. We have to assume that you would have some hazards associated with lifting. That is why we have ramps on the vehicles to reduce that lifting. It's why you have carry chairs and wheelchairs in the vehicle with you at all times as an option when they're needed. Some of the vehicles, I believe, have a winch to help with lifting tasks. This is how they apply. Okay, and our last job on that question is the policies, protocols, and good practice. For this, you'd want to name a few of your policies. I've given you some ideas there: manual handling, health and safety, or equality and inclusion policy, and you'd want to say what they actually say about preparing the vehicle. We can include the protocols and good practice in this as well. You could write that all together because your protocols and good practice will be following your policy. So, next question. We want to identify materials that might be considered to be hazardous and or require special transportation needs. So, again, pause the video, write down as many hazardous materials as you can in 2 minutes. Okay, now that you've that done, let's see how your list compares to mine. I've only put up a few. Oxygen, clinical waste, used linens, these are the most likely ones that are probably going to end up on the vehicle. It might come about that you have to carry some sort of chemical, such as bleaches or detergents. which actually I would count bleaches as a corrosive substance as well. I have corrosive listed separately down there. Bleach would count. If you spilt it on your skin, it would be corrosive. Acids as well would be problematic. Other things that you're highly unlikely to be carrying are radioactive materials and explosives, or other toxic substances. Let's say lead, for example. You're unlikely to be carrying lead, but it is toxic and it's generally not good for you. So if you can think of any more, that's great. That would get you started. Our next thing is to describe the precautions to be taken when transporting materials that are hazardous or require special storage conditions or transport. So in this question, we want to describe what you do with the substances. So how is oxygen, used linen, and clinical waste transported and or stored? For the oxygen, you could describe how it is checked before you set off. You check the levels, you check the maintenance dates to make sure it has been checked lately. You also check that it is strapped in and secure. For used linens, once they're used, they're bagged for transport back, and as soon as possible gotten off the vehicle and put in for laundry. Clinical waste, bagged in the yellow bags. You're using, for both linens and clinical waste, you're using gloves at all time. And once you have it bagged in the yellow, once you have the clinical waste bagged in the yellow bags and you get back to base, you dispose of that as soon as possible in the clinical waste bin. And then you wash your hands again as soon as possible. Let's see. 1.4, we want to talk about identifying your own role, responsibilities, and accountability when preparing vehicles. So we want to talk about what you actually do to prepare the vehicles. What are you responsible for? What are you accountable for, and to whom? So some things that you might want to include in your answer here could be, again, the vehicle checks that you do. What is included in the vehicle checks? You're looking at the interior, the exterior, the lights, the oil, screen wash. What do you need to do there? You're responsible for the health and safety of the vehicle, and therefore safeguarding patients or service users. And then for accountability, you're handing in that vehicle check form back to your supervisor. That's going to be checked. You're accountable there. You would be, if something goes wrong and you haven't checked the vehicle, then potentially you're accountable to the patient and their family, and could potentially lead to lawsuits or disciplinary action if something does go wrong and you can't show that you have checked it and it was safe to go before you left. So that one should be fine. These two I've taken together, 2.3 and 3.2. Describe basic maintenance tasks and repair tasks required to correct any defects or faults in the vehicle or specialist equipment, tools, and regular equipment. And 3.2, explain how to report faults and problems within the vehicle in order to ensure safety. I think those would go together. So just to show you, specialist equipment is said to include ramps and hoists. And for these questions, we want to know what you do to maintain the vehicle and equipment. I would consider the vehicle checks that you do to be a maintenance tasks. You are checking that they are safe, and if they need anything, I would consider that to be a maintenance task. After that, it's what would you do if there was a fault. If a fault occurred and you found it, you would probably first call control and report it. and see if it is something that you can continue with or if it has to be fixed that day and that vehicle has to be taken off the road. You would also fill out you put it on your vehicle check form. I believe there's a space for that, and you'd fill out the vehicle defect form and hand that into the office. So 4.2, our last question, explain how to report any shortfalls in or damage to material and equipment to be transported. So if there was a shortage of any equipment on the vehicle, the first thing you do is check the store cupboard and restock it. Now, if there was a shortage in the store cupboard or there was damage to the materials or equipment, then in those cases, it depends on your setting and what the procedures are there, so do double check before you write your answer. But you would either report it verbally or in writing to your supervisor. You would, now, if this continued and if you thought that this was going to contribute to it being unsafe, that it would be an unsafe practice to continue operating with the shortfall in materials or equipment or the damage to materials or equipment, then in those cases you would follow your safeguarding procedure. It would be an unsafe practice that falls under safeguarding. You'd check your safeguarding and your whistleblowing procedure, and first of all I'd report it again to my supervisor. But if things still aren't done within a reasonable time and you think it's unsafe, I would escalate to the next person in line for that. Okay, I hope that's okay for everyone. Thank you for listening. Complete your workbook and return it to your tutor as soon as you can. Have a good day.